Good morning. This is Terry QT, and I am with Ginger Hultin. I'm going to start over. It's an early morning. Welcome to the Zoom pandemic. I'm Terry QT, founder and director of Deep Sea Foundation. Good morning, Ginger. Welcome to our educational video channel, where we talk about all options and topics related to breast cancer, breast reconstruction. It's a broad range of topics. So this morning, I have the honor of having back on the program a friend of mine over in Seattle. We're still separated by the city, but mostly by the pandemic. Her name is Ginger Hultin, and Ginger is a registered dietitian, Seattle-based, and she's a nutritionist at Champagne Nutrition. I love that name. I need a champagne right now, I think. She's a spokesperson for the Academy of Nutrition and Dietetics. And so I'd like to welcome you to the program this morning, Ginger. How are you doing?
I'm great. Thanks for having me. It's so wonderful that we can still do some education and get to see each other in this way, like, whatever it takes.
I agree. I think I need more coffee this morning, though, maybe. We got an important topic this morning. So, I reached out to you to do another video. Thank you for stepping up to the plate and to help discuss this topic that I get a lot of feedback on. So, if a woman is undergoing breast cancer treatment, or she's woman or man, preparing for surgery, recovering from surgery, I know that sometimes you're concerned about weight loss, you're concerned about weight gain. But I went to a presentation that you gave in February. You're very evidence-based, which I like. I kind of like to wrap my mind around labels when I go shopping. And so I brought some props this morning. And so what I really want you to answer, what I'd like for you to answer first, Ginger, is what are the key items we're supposed to be looking for on these labels? Weight loss, weight gain, nutrition, because here's what I noticed. I'm looking at these labels this morning. They're so consistent. Tell us how they set these up. Fat, cholesterol, sodium, and then sometimes you get a mix like with this soup, potassium. I look at this box. Fat, cholesterol, sodium, and then of course the sugars. Can you break that all down for us?
Yeah, I'm so glad we're talking about this. And when people are going through treatment of any kind, but especially for breast cancer, weight becomes a very interesting conversation. A lot of medications will drive weight gain. If you get put into medical menopause all of a sudden, it happens to women, then you can experience weight gain because of that, hormonal shifts. And a lot of people actually lose weight too because they're going through treatment and surgeries. So everyone's a little different, and you'll see both weight loss and weight gain. Reading labels is very important to understand what's going to be best for you.
So then let me ask you this question. And I know this is very dependent on what is going on in a patient's life, whether it's treatment or pre or post surgery. How many calories on average, and I use that word in quotations, on average, should we be consuming each day?
Yeah. It's a question I get a lot too, and it is important to understand that as you go through treatment and life, your calorie needs change. If you have surgery, your calorie needs go up. If you are an athlete or increasing exercise, your calorie needs go up. But on average, most people need around 2,000, and that is really helpful because that's actually how the labels are set up. So all the recommendations that you see, like what does this percentage mean, or how do I understand this? It's about 2,000 calories. Keep in mind, some people need way more. I've seen people need up to 3,000 calories. Some people need less. A lot of people think they need less than they do. A lot of my patients, they come to me and they're eating like 1,200 calories. That's almost always too low. That's what, like, when you put in your weight loss goals into like an app, that's often what it gives you. But it's really important to work with your medical providers, especially registered dietitians, because we can really look at the whole picture and help you understand how much you need. But 2,000 is the simple answer as a rough guideline.
You bring up a really good point, because without naming any apps, that needs, I think people need to really be careful of that, because I've done that before. I know exactly what you're talking about. You're like, okay, I want to lose, 10 pounds by the wedding. I want to lose 5. I need to gain 5 pounds for surgery. And it will automatically give you a number, but it's so important that those calories are based on nutrition. So when I look at a label, I'm looking down at this box right now, without giving any, without promoting any one particular product, which I'm not, by the way, but I'm looking at the labels today. What is it that we need to be concerned about with fat, cholesterol, sodium? When I think of sodium, and I think of cancer treatments or surgery, I think of the word inflammation. And inflammation, to me, not a registered dietitian, but in my mind, I go straight to sodium. But maybe not. So
yeah, sodium is an interesting question, and I'm really glad that both sodium and potassium are on the labels, and potassium's new. So a lot of the things we're talking about is very interesting because there were some recent label changes. Sodium is an electrolyte, as is potassium. Both are important for anyone that has any kidney issues. So that's a major reason that potassium was added. But sodium really plays a huge role in your cardiovascular system and especially your blood pressure. So the most important thing about that to understand is how much you need in a day. And the guidelines are very solid at don't go over about 2,300 milligrams. But if you can go lower, a lot of the recommendations are closer to about 1,500 milligrams, especially if you've got high blood pressure or any blood pressure issues. So it's kind of easy to remember, around 2,000 calories, around 2,000 milligrams of sodium.
I love that, because I was looking down at this box. They're in milligrams. That's how they list it on American labels, at least. So who sets up all these label guidelines?
It's all done by the government and the guidelines that really look at what is a healthy diet generally. And that's a hard job because we're a very multicultural country and a lot of different people. So they are trying to set up guidelines across the board. That's why it is important to get some individualized help, but it is kind of cool. They give you information, they give you portion size, how many calories. There are guidelines as far as fat, sugar, sodium. So as long as you know that, then you have the information you need to start to interact with the labels.
So, they always put portion size on here, servings per container. I got to tell you, my mom was measuring stuff out. She still does. She takes her little cup measurement. She was kind of my, I know, right? She was kind of my mentor on this. Why is it important? I think that is obvious. I feel it's very important to follow those guidelines. I was told by a registered dietitian at a cancer center one time, I'm holding my hand up, handful. And oftentimes if I measure out some nuts or, dried fruit, even cereal, a handful, it seems to be standard. What are your thoughts on that?
Yeah, this is such an interesting conversation. One of the most useful guides for weighing and measuring food is to start to understand what it looks like. What does a cup look like?
Yes.
What does a tablespoon look like? They did recently update actually the portion sizes because, as many people know, they seem a little small. So for example, I think the ice cream portion used to be a half cup, but now they increased it to 2/3 cup because that's more realistic for what people will eat. The thing that's helpful when you're learning is, let's say there's, 200 calories in a serving of ice cream. What does that look like? And if you eat 3 or 4 servings, you're getting, upwards of 500 calories, which could be fine or could not be fine depending on your goals. So ultimately, I try to move my patients into the realm of being more intuitive about their eating, getting to understand what fits into their life and not having to weigh and measure and just being able to eat what feels good for them based on their hunger. But on the path to get there, sometimes it's helpful to have some learning and do some measuring to say, oh, this is a portion. How do I feel when I eat that?
You know what? I love that visual approach because honestly, okay, full disclosure, I had some M&Ms the other day and I literally measured them out, and I have a small ramekin. A serving of M&Ms. I know the high sugar, bad, 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 but we got to treat ourselves once in a while. It literally just barely covered the bottom of that ramekin.
Ah, interesting.
So I think that visual approach, measuring stuff out, and if you do it, even for a week or a week and a half, do you have a week or week and a half in your life to start measuring this stuff out? Yeah, I think you do. Think of it as an investment in your health. So I really like that visual approach to measuring things, and then to getting that visual of what it looks like on your plate. So to wrap things up, Ginger, we touched on apps and all of the tracking and measuring and all that. Just to wrap it up, what's your biggest advice for tracking calories in, calories out, and making it simple for breast cancer patients or those going through surgery? They're already overwhelmed emotionally. What's your key advice on that?
Well, it probably isn't super surprising. My biggest advice is to get a registered dietitian on your team, because we can actually take some of that guessing game and some of that work off of your plate. I can give you, this is what you should eat. I can tell you how many calories. Like, I can really help guide and just make it easier so you don't have to guess. Other than that, I think a little bit of food tracking is super helpful. I do like those apps. It gives us information. Food track for 5 days or a week. You'll see trends right away, and it will tell you, oh my gosh, I'm only eating 1,000 calories. That's too low. Or, wow, I'm hitting about 3,000 every day. That might be too high. It just gives you information, no judgment, no good or bad, but learning to help yourself along the way.
I love that. The word learning. I think that's we're going to end it on that, Ginger, and I'm going to have your information. I like the fact that you mentioned to contact a registered dietitian, and I'll certainly have your information at the end of the video. And I think it's probably important that patients, I would encourage them to ask their healthcare professional, because honestly, I have dietitian friends. I wish you guys were tied into all a coordinated care effort, but sometimes you just have to ask. So I'm encouraging you guys to, the viewers today, to ask to see if there's a registered dietitian on board. And again, we'll certainly have Ginger's information at the end of this video. Thank you so much for joining me today, Ginger. Great information. Stay safe.